Sophie and Vic, it's great to have you on and really looking forward to our conversation here. We can just start with giving a brief intro about yourself and the work you're doing. We'll start with you, Sophie.
Yeah, thank you, Riley, and thanks to the HITLABs team. I'm really excited to be here. Hi, everyone. My name is Sophie Park. I'm the managing director for Bayer G4A. We call ourselves an accelerator, but more could be a hybrid of an operational VC too, but we've pivoted quite a bit. We support early stage, digital health companies. My work here is to sort of bridge a lot of the collaborations and investments with different teams within our organization. So really excited to be here. Thank you.
Excellent. Thank you. And Vic, go ahead and give yourself an intro and tell us where you're calling from.
Sure. Thanks, Riley. Excited to be here with Sophie. My name is Vic Tandon. I'm the Director of Health Innovation Product Strategy for Blue Shield of California. Blue Shield of California is one of the not-for-profit plans based here in California. We cover almost 5 million Californians for their healthcare coverage. Been with Blue Shield for about 7 years, kind of decades of experience in digital health, and our team here really focuses on working to explore and advance new technologies and new tech-enabled capabilities for Blue Shield, and helping us to meet our mission to provide affordable, accessible care to all Californians. So excited to be here and looking forward to the conversation.
Excellent. Well, let's dive right into one of those technologies that is a pretty hot button issue these days. And Sophie, we'll start with you. I'm, of course, talking about AI. Can you take us through, from an investor perspective, how you're looking at AI or being thoughtful or intentional, especially with kind of just a recalibrations of expectations around what it's going to bring in 2024? How are you positioning that in the types of projects or collaborations you're looking at coming up this year?
Yeah, so the hot topic of AI. I mean, we all know that, we were just joking recently with a couple of investors, it just seems like every pitch deck we see just has, AI this, AI that does X, Y, and Z. And I think it's starting to become one of those words where, everyone just kind of uses it, but then now you do a little bit of a deeper dive into understanding, what type of AI is it? Is it reactive? Is it, is it limited? Is it theoretical? Is it, self-aware? Like there's a lot of different branches of AI, but, AI in healthcare has been around for decades, right? And we all sort of know that. And as you said, a lot of the investor sentiment around this is, what is it really doing, right, to achieve a lot of these outcomes, right? What is it doing to support, operationalizing or better operationalizing workflow for, not just physicians, but also the people utilizing these types of products and solutions. And so, a lot of investors do think that this AI hype train, because of the open AI and things like that, that's been coming out, it's definitely a hype, but at the end of the day, it is a technological improvement that's significantly needed. We all know that. It has huge potential in healthcare, whether it's just a decision tree or whether it's, whether it's self-aware, right? Whatever it is, it'll change the face of what we know as healthcare today. And so the way that we're actually looking at this, because we've always been looking, a lot of our portfolio companies already have had AI years ago, but the way that we're really looking at it is from almost like a health economics perspective, because at the end of the day, these are not just big techs that you're trying to get out into the world and get random people to use. Like, they have a really specific and significant, purpose, right? What's the purpose? What are the outcomes that it's driving? So at the end of the day, we try to weave health economics into the way that we look at AI as well.
Yeah, thank you. I think that's really important. And Vic, I'll toss it over to you from your perspective, for the providers and payers. How are you looking at AI in 24, and what are your visions for it in regards to the work that you do?
Yeah, so I think from a health plan perspective, and certainly kind of the peers I talk to in industry, the focus is kind of threefold. One is primarily on what's the user benefit or user need that needs to be fulfilled. Second is the business value, right, that the technology could prospectively deliver. And third is, frankly, the capability of the technology itself. So what I've kind of seen, and Sophie and I were chatting about this earlier this week, is there's been a lot of kind of historical hype, particularly the last 5 to 7 years in the industry around AI and emerging technologies. And I think that technology is now actually catching up to the hype and the aspirations. But enterprises, certainly health plans and providers, I think are becoming more smart about the technology, able to ask more probing questions of vendors who are pitching that as part of the solution. But more importantly, are really taking a thoughtful approach to understand the needs and problems that they're trying to solve for, whether it's their own, their own employees, from a health system perspective for their providers and staff, or from patient or member perspective, providers, brokers, employers, and just trying to understand what problem are we trying to solve for? What's the business value that we're going to derive? And is AI the right technology to solve for this particular opportunity or not? And so, yeah, I think there's a lot of promise around artificial intelligence and generative artificial intelligence in particular, but it's paired with a lot of, I think, sobriety around what are the key business opportunities and business value that we're trying to derive. What types of operational changes might be necessary to take full advantage of the technology, with a firm focus on the needs of the user to ensure that value is actually realized.
Yeah, I think that's speaking to an important point of really doing due diligence to understand the technology, the application of it, what are the outcomes they're trying to bring about. And it touches upon kind of this idea of inherent risk and riskiness from partnering with or investing in companies that are utilizing AI or bringing the next kind of AI tool to market. So Sophie, can you touch on how you mitigate risk, or what are some kind of risks that you see that are related to healthcare projects and in the uniquely rapidly changing healthcare industry? How do you view risk or assess it?
Yeah, so that's a good question, because I'll be honest, when I joined G4 a couple of years ago, we sort of looked at due diligence from just a very financial investor perspective, right? Like the usual questions you ask, right? What's the traction? What's your cash flow? What does the user look like? What does engagement look like? That was such a big term. What is the engagement? But the more that I've seen, I've looked at thousands of companies and also talked to hundreds of investors. And one of the biggest standouts that I see that's sort of missing still, some investors are now getting on board with it, right? Because as we talked about before, investments are becoming a lot more thoughtful and a lot more intentional these days. But at the end of the day, it's about understanding, or investors being able to understand the principles of health economics, right? Not just economics. Because, when we think economics, we think, okay, there's the market, there's supply and demand, there's, the risks that are associated with it, there's the cost, the margins. But when you think health economics, it's not just about like the scarcity, it's not just about the supply and demand, but it's about distinguishing between need and the demand, right? And that's so tough in healthcare, because you think that there's so much demand and yet the needs are also quite clear. But it's also understanding the opportunity costs, right? And once we talk opportunity costs, it's about understanding the time horizons, right? Payment reforms, like the risks and insurance and benefits that all come with that. And not many investors are aware, and you saw that in the last couple of years where we've seen tons of money flowing into digital health, tons of investments happening, companies that are worth billions of dollars that probably should not have been, right? And then you also understand, and then also going back to health economics, the efficiency, right? When economists talk about efficiency in goods and products, right? In healthcare, it's called outcomes, right? What are the outcomes that we're actually seeing with your product or solution? What outcomes are we seeing when we give you $20 million? Is it worth the $20 million? And then on top of that, when you actually think health economics, that's hand in hand with equity, right? And so how do you quantify? I think even our team has been, trying to quantify the value of equity in healthcare as well. Because again, right, we all know social determinants of health. It's huge, right? It's dependent on interventions, it's dependent on the programs, the systems, and even policies. And so I'd say, I know it's a long-winded, answer, but I would say understanding the principles of health economics is so important, at least for us now. And it's not just looking at, well, what's your cash flow? What's your revenue? Who's on your cap table, right? That's number two. It's about, well, do you understand what's scarce? The, supply and demand. Do you understand the distinction between the need and the demands of patients and the physicians and the payers and whoever else is in this, cycle of healthcare? So I'd say we started looking a lot more at what it means to be a company within the ideas and ideals of health economics. I hope that helps.
Yes, yes. No, thank you for sharing. We're all here learning together and wanting to hear from your perspective. So we appreciate any length of answer you're willing to give us. And then Vic, last question for you. Do you think that the business cycle has fundamentally changed? Do you think that payers are perceiving the shifts in healthcare investments and business models as a result of this business cycle, or is it more of fundamental transformation driven by market needs and technological advancements?
Yeah, great question. The pithy answer is both. So I think there is both a transformation in thinking in large enterprises in the healthcare sector around a focus on value and outcomes. But I think there's also been a change in the business cycle, right? So I think the increase in cost of capital, certainly making plans and providers more thoughtful about the investments that they're making, particularly technology investments, with just a clear focus around, again, business outcomes, user needs, and then matching the technical capabilities of vendors to those two dimensions of business value and user needs. So so I think it's both a fundamental shift in the industry of more kind of thoughtfulness, more focus on outcomes and delivering value with the promise of new technologies, but also a shift in business cycle and where we are in terms of interest rates, in terms of regulatory and legislative changes. But it's all really geared towards what we all are in healthcare for, which is serving the needs of patients and ensuring that they're living their their healthiest lives. So lots to come certainly in the industry.